Professor George Milne's infectious diseases modelling has previously been used by state and federal health departments and the World Health Organisation. His latest work is on Omicron and WA's borders.
Our findings are pretty stark. It would have been pretty good if we'd opened last weekend, and it'll still be good if we open in the next month or two.
Professor Milne's analysis predicts delaying any longer would see case numbers rise significantly as the population's immunity wanes. Opening on March 5 would lead to a total of just over 750,000 cases. But by waiting until June, the predicted number of cases rises to 885,000 and more than 1 million if the border remains closed until August. ICU admissions and deaths follow a similar pattern. A March opening is predicted to see 293 people admitted to ICU and 383 deaths. But wait until June and those figures could rise to 360 in ICU and 478 deaths. Not opening until August is predicted to see ICU admissions climb to 443 patients with 594 deaths.
I think the reflection of the CHO is that Professor Milne has assisted with some modelling in the past, but he is not an epidemiologist. He's a mathematician, and we take advice from the public health officials who are epidemiologists.
Yes, I am a mathematician, that's quite correct, and a computer scientist, and an infectious disease expert.
The state opposition has been calling on the government to release its Omicron modelling.
It should be public, it should be transparent, and it would give confidence to people that the Premier is making decisions not based on polling, but on actual advice and modelling.
The Health Minister says modelling is not the only factor being considered.
What we want to do is increase those vaccination rates across the community before we have a steep spike in Omicron.
Despite WA's border rules, travellers continue to filter in under the new relaxed settings. 80 of today's 94 new COVID cases arriving from interstate and overseas, meaning they're forced to get tested. To ease pressure on PCR testing clinics, all arrivals at Perth Airport will now get 2 free rapid antigen tests to take on days 1 and 6 of their isolation period. All positive results must be registered with the Health Department. Rhiannon, ABC News.